name is Joshua, and I'm a sleep clinician and the head of clinical testing here at SleepSomatics, a sleep lab in Austin, Texas. This video is a part of a series of articles on our website that talk about restorative sleep. This particular video gives a summary of the information that's contained in those articles. Links to those articles can be found at the bottom of this video in the description section. Video is going to talk about what restorative sleep is, what the symptoms are of poor or reduced restorative sleep, what some of the causes are of reduced restorative sleep, how we fix broken or incomplete restorative sleep, and then how we measure restorative sleep itself. What's the technical and clinical process for going about and determining that? So that's what this video is about. Let's first start with the 5 big myths of restorative sleep. Before we get into the meat of the video, let's just kind of get those myths out of the way, because those tend to be the first 5 things that most patients, when we see them here in the clinic for initial consultation and assessment, those are the 5 myths that people tend to have. And in our clinical experience, I've been doing this now for 10, going on 15 years now. In my clinical experience, those are the 5 myths that we have to overcome before we can start actually treating a patient, because of the amount of misinformation that's out there, not only on the internet, but frankly in the medical community as well. Myth number 1, sleep is a static and unchanging process. And there's simply no way that I can explain how wrong that is, other than to say it is wrong. Sleep is a dynamic environment where neurological, biological, hormonal processes are occurring, and sleep is changing throughout the course of the night, neurologically speaking. We'll get into that here more in just a moment, but that's myth number 1. Myth number 2, that the total amount of sleep or sleep time is more important than the sleep architecture itself. What do I mean by that? Well, most people tend to focus on the total number of hours that they're sleeping and not on the quality or continuity of that sleep. They say, well, I sleep 8 hours a night, or I sleep 6 hours, or I sleep 10 or 12 hours. I nap throughout the day, and yet I still feel tired or fatigued. Well, sleep duration is important, yes, but it's the quantity and continuity of that sleep that is more critical than the total duration itself. And we'll get into that more here in just a moment. The third myth, sleep apnea is the cause of all sleep problems. Thanks to the internet and a lot of very large, powerful corporations that make a lot of money treating sleep apnea tends to be the primary and sole disorder that people discuss. What do I mean by that? Well, sleep apnea is critical, and we'll talk about it a little bit more here in a moment. It is an extremely important and critical disease in sleep medicine, and from a statistical perspective, it tends to be the primary sleep disorder, other than insomnia, that we tend to see, and therefore there's a greater focus in the literature on identifying, treating both short-term and long-term sleep apnea. But it is not the only cause of sleep problems. And so we risk overlooking or failing to diagnose correctly in a clinical setting other problems with sleep if all we're focused on is a person snoring and sleep apnea. So that's the third myth. The fourth myth, Fitbits and home sleep tests measure restorative sleep. No, they do not. And you'll understand why as we go into the neurological stages and processes of restorative sleep. Fitbits are great in the sense that they can provide some information to help people who are trying to get in shape and who are focused on their health. Here in Austin, wellness is a big focus, and holistic medicine, diet, exercise, and lifestyle are things that people are focused on, and Fitbit can be helpful for that. But Fitbits and home sleep tests, which you hear a lot about in medicine nowadays and that you see on the internet, tend to give the misperception that they themselves measure restorative sleep. They absolutely do not whatsoever. And anyone that tells you that is lying to you. And we'll talk about that more here in just a moment. Myth number 5, sleep testing is unnecessary, invasive, and scary. Potentially, it could be invasive or scary if it's performed incorrectly, either in a clinic that's not accredited like ours or is not licensed like ours, or if it's done with incompetent, frankly, sleep clinicians or sleep technicians. But sleep testing on the whole is both vitally necessary to understanding a person's sleep problems and resolving their symptoms and disorders. It is not invasive, and it certainly is not scary if it's done correctly. So those are the 5 myths that we tend to focus on when we're initially working with a patient, so that way we can get to the more critical issues regarding their sleep. As it relates to restorative sleep, though, if we can move past those 5 myths, and we'll get into more of those here as the video goes on, but restorative sleep itself, quite simply, is where we are looking at the neurological architecture of a person's sleep. So, as we said in myth number 1, sleep is neither static nor unchanging. Most people think that we, at one point, are in a state of wakefulness, and then the next moment we're unconscious and unmoving. And somehow, magically, 7 to 8 hours later, we open our eyes and everything is fine, and we should have not woken up at any point or moved in the bed, or nothing happens. And in reality, the moment you fall asleep, the brain begins to alternate through these shifting frequencies of very light and very deep sleep. And if you were to draw on a map what we call a hypnogram, these different stages of frequencies, you basically rotate throughout the course of the night, very light to very deep sleep, very light to very deep sleep. Okay? And the 2 stages that are particularly important that we look at in a sleep study, or a polysomnogram, is delta wave or slow wave frequency sleep. You'll see it, those 2 terms used interchangeably, delta frequency or SWS, slow wave sleep, and REM sleep or rapid eye movement. Delta wave frequency sleep, which tends to be more critical and seen more frequently in younger patients and less frequently in much older patients. Delta wave frequency sleep is a very deep, deep stage of sleep. It's very difficult to wake a person from delta wave frequency sleep. It tends to occur in the early evening hours, and it has very specific brainwave frequencies. During delta sleep, the body is undergoing physical rejuvenation. Many of the hormonal processes that occur in sleep occur during this stage. This is when we tend to see growth hormone and testosterone released. This is when we tend to see glucose levels stabilize. This is when we tend to see leptin and ghrelin, the appetites responsible for appetite suppression and regulation of appetite. We tend to see these stabilize. Commensurately, if you have poor delta sleep or broken delta sleep, we commonly see a person who has low growth, who has difficulty losing weight, who has difficulty controlling their weight through diet, has more fatigue, less energy, and more difficulty when trying to work out or have energy to be productive during the day. Younger people tend to spend a predominant amount of their night in delta wave sleep. And as I said, this is a very difficult stage of sleep to wake a person from. So this is why it's so difficult to wake a teenager up early in the morning. The body is undergoing explosive growth when we're much younger. And this is the stage of sleep that's critical to that. Okay. And then on the opposite end of very deep sleep, you have a very light stage of sleep, REM, or rapid eye movement. And this is the stage of sleep most people are familiar with. It's when we dream. So whereas the body is repairing itself and preparing for the physical activity of the following day, REM sleep is when the brain is repairing itself. This is when moods tend to stabilize. This is when memory allocation and retention occurs. This is when the brain is awash with electrical activity. And it's the stage of sleep most close to a state of wakefulness. So whereas we spend a large percentage of our time in delta wave or slow wave sleep in the early part of the evening, we commensurately spend a larger percentage of the early morning hours in REM sleep dreaming. In fact, this is why most frequently people tend to wake up after that final dreaming period in the early morning hours. When a person has low REM sleep, we tend to see that they have an increase of mood disorders, depression, anxiety, irritability, We also tend to see lower libido issues in men. There's a wonderful episode of Star Trek: The Next Generation, because of Paramount and YouTube licensing, of course. I won't include it in this YouTube video, but you can certainly Google it or look for it. But it was an episode where the Starship Enterprise, I'm going to nerd out here a little bit, the Starship Enterprise encountered another vessel and through the magic of science fiction managed to get stuck, and the crew began to experience hallucinations. And what eventually the good doctor was able to identify was that there was an alien species in the area that was attempting to communicate with them. And the way that they were communicating was on a wavelength that disrupted REM sleep. And what she says in the episode, Dr. Crusher, Captain Picard, is that none of us, the crew, are dreaming. We are not entering REM sleep. And that is why, even though we will sleep 4, 6, 8, 10 hours off shift, we are irritable, aggressive, moody, suicidal, and in some cases of the crew, schizophrenic. Okay? These are all things that are true. In a clinical setting, if we suppress REM sleep long enough in an adult, over the course of several days, we will start to see a form of psychosis develop. And there is what I would say after over a decade of doing this, I would say there's an epidemic of REM sleep loss in the modern American culture for a variety of reasons. If you feel very groggy and you feel moody and irritable in the early morning hours, deficient REM sleep would be the first thing that I would tend to look at outside of the normal endocrinological issues, such as poor vitamin D being probably the most common. So REM sleep and delta wave sleep are equally important. It is so critical to our growth and our survival. That is probably one of the primary issues in medicine today. Of all the different things that we focus on, weight, cutting caffeine, alcohol, tobacco, nicotine, eating correctly, reducing sugar, removing trans fats, getting exercise. You think of all the different things that we focus on in preventative medicine and primary care, and yet sleep is almost never mentioned in an annual wellness exam, other than, do you get 7 or 8 hours of sleep? Great. Well, just because you get 7 or 8 hours of sleep doesn't mean you're getting the sleep that you need, and that's myth number 2. So again, myth number 1, sleep is static and unchanging. Not the case. Sleep is a dynamic environment, and it's extremely critical to our growth and our survival. So then when we get to myth number 2, sleep time being more important than the quality and continuity of your sleep, well, if we just talked about how critical delta wave frequency sleep is and REM frequency sleep are, and for adults, we spend optimally between 20 and 25% of the night in each stage of sleep, meaning 50% of the night is spent in some form of biological or neurologically restorative sleep. Well, what if you're a person who sleeps 8 hours but only spend 10% of the night between those two stages of sleep? Well, then it wouldn't matter whether you slept 8 hours, 10 hours, or 12 hours. You're not spending a sufficient percentage of that time biologically or neurologically repairing yourself and preparing for the next day. And that's why sleep time is not necessarily the most important factor in a person's health, because it's the continuity and quality of that sleep, what stages of sleep you're sleeping in, that are the most important. In other words, as I mentioned at the beginning of this video, I would rather have a person sleep 6 hours and get perfect amounts of delta wave and REM sleep than have a person sleep 10 hours and only get 5-10% of the night in delta or REM sleep. And the reason why is because if you take that total percentage of time, the person sleeping 6 hours but getting the correct percentages of their restorative sleep is getting more total restorative sleep than the person who's getting more total sleep time. So it's critical to look at the neurological quality and architecture of that sleep. We call it sleep architecture here in a clinical setting when we perform a sleep study on a person. So when we look at myth number 3, sleep apnea being the cause of all sleep problems, sleep apnea statistically is quite common. Probably 1 in 4, 1 in 5 adults in the U.S. is at risk for sleep apnea. If you think of your upper airway being like a pipe, right, going from the back of your throat down to your lungs, all that's happening with sleep apnea is these muscles that are up here in the pipe are relaxing as you fall asleep. Particularly when we go into REM sleep, the body loses muscle tone, the muscles tend to relax to ensure we don't act our dreams out. And these dilator and pharyngeal muscles up here in the upper airway are no different. They tend to relax, and that relaxing causes a restriction. And if you can imagine it being like a pipe, then that pipe just starts to restrict slightly. And it's the narrowing of the airway that increases snoring and causes the choking sensation associated with sleep apnea. Well, that reduces oxygen in the blood. It can increase carbon dioxide because you can't exhale out through that airway blockage. It causes a whole constellation of symptoms. It increases your blood pressure. It can cause a stress response or an adrenal fatigue response. It can spike different stress hormones in the blood and release from the heart. And it can lead to a significant number of different issues. Increased risk for a heart attack, stroke. We now think cancer in some very particular narrow situations. More commonly can put you at a higher risk for a car accident. Certainly leads to lower libido and ED in men, which tends to be more of a focus or a concern than having a heart attack. But so it creates all different sorts of problems, okay? But it is not the only problem that's out there. There are 70, maybe 80 different sleep disorders, and they fall into about 5 broad categories. This video is not intended to go over all of those, but suffice it to say that sleep apnea is not the only issue with sleep. And again, if we go back to what we just spoke about, the neurological quality and continuity of your sleep, a person who doesn't have sleep apnea but has poor amounts of delta or REM sleep has just as much problem, just as much issues with low fatigue, increased irritability, sleepiness during the day, and just a reduced quality of life than a person who stops breathing 10 or 20 times an hour, but who otherwise has normal levels of restorative sleep. Do people with sleep apnea have poor restorative sleep? Absolutely. Okay? We see it all the time. It's a natural consequence of having a disruption to your sleep from those breathing pauses. But is it the only thing that causes it? No. There are any number of different things, and read the article on our website for a more detailed description. Lifestyle can certainly affect it. Alcohol, believe it or not, does tend to deviate the sleep architecture. It can kind of increase the delta wave sleep at the expense of the REM sleep. So using alcohol to help you fall asleep, not a good idea. Any number of different medications are known pharmacologically to suppress or delay one or both stages of sleep. We at SleepSomatics tend to avoid, if at all possible, ever suggesting that a person go on a short-acting sleep aid like Ambien, Lunesta, Trazodone, Seroquel. These medications are associated with deviating your sleep architecture. Just because they help you to fall asleep or stay asleep doesn't mean that they improve the quality and continuity of your sleep. Many different antidepressants, SSRIs, or selective serotonin reuptake inhibitors, benzodiazepines, many different psychiatric medications can alter the structure of sleep. Does not mean that you should stop taking those medications or change them. It's just if you are on those medications and you are having symptoms of poor restorative sleep, the fatigue, the sleepiness, the lower quality of life, the mental fogginess during the day, then those are things that you want to talk to your prescribing a physician about and see if they should order a sleep study to make sure that the medication schedule you're on isn't reducing your restorative sleep. Sometimes we take medications because we have a symptom. We're sad, we're fatigued, we just have lower quality of life. And then the medication helps with the symptom, but if it reduces our restorative sleep, that ends up creating a new constellation of symptoms. And then we have to chase those symptoms with other medications or other drugs, and it just becomes a vicious cycle for some people. Fixing the restorative sleep from the beginning tends to alleviate or reduce those problems. Myth number 4 sort of is a good transition for this, because if we understand how important restorative sleep is, and if we know that there is potentially an issue with our restorative sleep because of the symptoms we have during the daytime, either emotional, mental, cognitive, or physiological, difficulty losing weight, low energy, different things we talked about, then the question is what's my restorative sleep? And you know, it would be nice if we could measure that with some sort of app on an iPhone, but the only way to measure your restorative sleep is to have some sensors on top of your head, okay? Now, a polysomnogram, or a traditional sleep study, is itself a non-invasive test. Some sensors go on the outside of your person. Here at our clinic, you don't even have to take your own clothes off or be examined the night of the test. You simply go into your private room or your private restroom, put on your own sleep attire like a pajama top and bottom, t-shirt and shorts, tank top and sweatpants, and then we place some non-invasive sensors on the outside of your person. That includes some wires that go on your head, okay? And it's not painful. There's no hospital tape used. You'll read sometimes online about the goop that people had in their hair after a sleep study. We tend to, the one we use here, which helps the wires to conduct the electrical signal through your skull from your brain, we use a type that is water soluble, so it simply rinses out of your hair when you take a shower in the morning. But all of those sensors go on the outside of your person. There are no needles, no harsh chemicals, no physical restriction, okay? Meaning you can get up, you can walk around, you can go to the restroom whenever you need to throughout the course of the night. You can sleep in any position you want to. You're not tied down or restricted in your movement or forced into a position in bed. And there are people who frankly do Cirque du Soleil level acrobatics in their sleep, and the sensors just simply move with them. It's an entirely mobile system. But it does require that sensors be placed on you. So a Fitbit that's worn around the wrist in no way conducts or records electrical signal coming from your brain to show us what the frequency is of your sleep, so we can map out on that hypnogram what the architecture of your sleep is, or measure the precise percentages or total durations of slow wave or REM sleep. Same with a home sleep test. A home sleep test is a measurement of your breathing pattern and your oxygen loss for the purposes of seeing if you are potentially at risk for sleep apnea. It has no sensors on your scalp. It has no sensors on your on the outside of your face, which would allow us to see if you're in REM sleep or not. It does not show us anything at all regarding your restorative sleep. When a person comes to a sleep lab for an initial assessment or consultation, like here at SleepSomatics, what they have is they have problems. And what they're looking for are answers to questions about their sleep. I am tired during the day. Why is that? Okay? A Fitbit or a home sleep test is not going to definitively tell you the answers to your questions, because it's not going to tell you what percentage of restorative sleep you have. Now, there are apps, and I've heard patients quote their Fitbit or an app that they have for their Fitbit or their Apple Watch or whatever peripheral they're using, and say, it says that I get X percentage of deep sleep. Okay, and that's based upon usually a technology called actigraphy, which was used in sleep medicine 10, 15 years ago and then was discontinued as scientifically unverifiable and unreliable. In fact, insurance companies won't even reimburse, as far as I'm aware, an actigraphy test for the purposes of diagnosing a person with a formal sleep disorder. That should tell you something. Because otherwise, if they would, everybody would be getting diagnosed off their Fitbit, and large corporations that make a lot of money selling you sleep therapy and sleep treatment would be attempting to sell you those products directly through your Fitbit. Okay? The fact is that anyone who claims to tell you that they can measure your precise levels of restorative sleep from a Fitbit or a home sleep test without a traditional sleep study mock-up, or what we call montage in sleep medicine, is lying to you. It simply cannot be done. There are ways to estimate. I'm sure that there are going to be people in the YouTube comments who will say, but what about this? What about this? What about yes? Yes, there are technically ways to potentially estimate certain stages of sleep based upon some what we call secondary indicators. But to give you a precise quantified measurement of everything regarding your sleep, there's only one way that can be done, and that's with a traditional sleep study. And so that goes to that last question of how do we measure restorative sleep. It is with a sleep study or a polysomnogram. Now we're going to be doing another video here shortly at SleepSomatics that talks about a sleep study and specifically a polysomnogram, because most of the information that's available on the internet is either outdated to current technology or is from a clinical perspective that is not friendly to a patient to understand how exactly it relates to you individually, and then again to track back to restorative sleep. So we'll be linking to that video here soon. But the short answer is, how do we measure restorative sleep? It is with a sleep study that does begin usually with a referral from your physician or primary care provider to a sleep clinic or sleep lab like SleepSomatics. If you live outside of Austin or outside of Central Texas and you're trying to find a sleep lab, you can go to the American Academy of Sleep Medicine's website. It's go ahead and Google it, obviously, just in case their website changes after I record this video. And you can look for an AASM accredited laboratory to see if there's one in your area that can help you out with whatever issues you're having. Again, we spend 1/3 of our lives asleep, and the continuity and the quality of that sleep is critical to our ability to be able to recover from the prior day and prepare for the next one. At SleepSomatics, our tagline is restore life with restorative sleep. Restorative sleep is critical to longevity and to quality of life and to overall happiness and well-being. It affects every area of our lives, and it's perhaps one of the most underrepresented disciplines in medicine as it relates to overall wellness. The question is, are you getting enough slow wave sleep and REM sleep? The symptoms to look for would be fatigue, sleepiness during the day, an inability to lose weight or an inability to gain muscle mass, reduced libido, irritability, depression, anxiety, just a general discomfort or reduction in the quality of life. If after waking up 30 minutes later, if you still feel tired or fatigued, if you don't feel like you're able to face the day without caffeine or additional substances or additional pills or medication, then it's potential that something's wrong. Restorative sleep has evolved over thousands of years to provide you the backup that you need in order to face the day ahead of you. And so if you're not getting what you need out of that 1/3 of your life that you spend asleep, then it's going to affect the other 2/3 of your life that you're spending awake, in which case you need to get help. There's no reason to continue to suffer. Find a good clinic with a good clinical team who can help you out. Whether that's us or someone else, hopefully you can get the help that you need and start getting the neurologically, hormonally, and biologically restorative sleep that you deserve to have in order to enjoy the life that you want. My name is Joshua. I'm a member of the clinical team and head of testing here at SleepSomatics. We do provide full service sleep testing, sleep studies, home sleep testing, CPAP, sleep apnea and snoring treatment, and even multiple sleep latency testing for narcolepsy, commercial driver's license, truck drivers, pilots, occupational, and employment safety and overall health and wellness. Visit us on our website at SleepSomatics.com. And if you do need help and you live in Central Texas, go ahead and consider scheduling an initial new patient assessment and consultation appointment through our website. You can also find information about referrals from your physician to our clinical team here at SleepSomatics. Check out our reviews on Google and on Yelp. Look forward to helping you out if you're in the area, and if not, we hope that you're able to get the help that you need. Thank you again. Restore life with restorative sleep, and we hope that you get the restorative sleep you need. We wish you restful, restorative sleep. Thank you.